Hi, my name is Dr. Gerald Deas. Welcome to the Health Center from Downstate Medical Center. You know, disease are preventable. I mean, we're living in a time of tremendous brain work. Things that are going on in the scientific laboratories and things like this is just overwhelming of how we can prevent so many diseases, and yet we're still dying from them. We're dying not so much maybe in our context of where we live at, but if you look the world over, TB and those kind of things, people are still dying from malaria, TB, and or infectious diseases, things that we haven't even heard of yet. I mean, that are coming in from different places all over the world. And all you have to do is have one person to come in and do that thing. You know, in fact, I heard one concept of a person who was a person on a in an airplane. They were the ones that served food. You know, they had HIV, and as he flew from station to station, he had all kind of relationships along the way, and of course they never could trace it back to the person on the airplane, but here it was, the spreading of a disease that was incurable. Can you believe that? There are many diseases just like that. That's why they have customs to see what's going on. In fact, you know, when I was in the Army, I was in a place where we did germ warfare. I was assigned because of my background. And I can tell you, germ warfare is no joke. And if you don't think countries have certain things like anthrax and things like that, that would be worse than a bomb, than an atomic bomb, because it could take out populations forever. You know, just one infectious disease. A bomb can take out a certain number of people, but infectious disease can take generations out, so forth. So basically, I got attuned to the importance of bacteria, viruses, and parasites and things like this by just being involved in that kind of studies and things like this. So it made me when I came into medicine, that was way before I came into medicine. I had been drafted into the Army, and then I came out and had to do a lot of other things before I got to Downstate Medical Center, which I'm celebrating my 50th year here this year as such. And yet even with that, I'm very disturbed a lot of times when I don't see enough African Americans in medicine, even at this medical school and other medical schools that I go to visit and things like this. So we have to start training more of our young people and get them more interested, you know, in medicine and other medical employment and things like this. You can start off from something very small like a nurse, and all of a sudden be ahead of something that's very important, such as HIV spread in these communities and all over the country. So I want to introduce you to Dr. Monica S.U.N.Y, who not only came to Downstate and was a nurse and everything else, but she also is now involved in how we can prevent AIDS and AIDS infection. Good, nice having you.
Thank you, Dr. Deas. It's always a pleasure to be with you.
Yes.
I like the way you talked about the smallness of the smallness of the universe now, because an infectious disease anywhere is an infectious disease that's likely to be in the next place very soon. And because of air travel, we're only a few hours away from every disease everywhere. So, but you know, we focus in this community and this country on treating things.
Oh, yes.
When what we need to focus on more is preventing things. We always do too much too late.
Yeah.
And that's where all the money goes.
Oh, yeah.
Not to prevention. So I just want to make the point that even though I focus on HIV and AIDS now as the Assistant Commissioner in the Department of Health of the New York City Department of Health and Mental Hygiene, I spent most of my career as a general internist and an clinical administrator of a community health center.
Where was that at?
Right in Bed-Stuy.
Right.
And right on Fulton Street in Bedford-Stuyvesant. And I made prevention what we worked on. Even as people came in for treatment, we always had to give them their prescription to be in charge of their lives. Prevention at the personal level. Right. And now I work on prevention at the population level in public health. And so whether you're looking at heart disease or diabetes or obesity or stroke or pneumonia and flu, all of them have a disproportionate impact on our community
Right.
because of all of the things that we call the social determinants of health. So a person's not very interested in taking care of their health when nothing's hurting them, when they have all of the challenges of low-paying jobs and high stress and racism and the landlord. And so my first message is prevention is more than whether or not we take a vitamin
That's
or
right.
whether or not we eat well, which is very important. But it has to do with educating ourselves so that we are in charge of what's going on with us.
Sure.
I'll give you one example.
Okay.
Do you know where almost all the incinerators are in this city to incinerate garbage?
I know one area of Brooklyn. In fact,
Almost all of them are located in low-income areas.
low-income areas, surely.
And then people wonder why people in low-income areas have more asthma than anybody else.
Well, can I stop you right there? Because that's important, because Kings County Hospital's been here a long time. When did they decide to put garbage trucks directly right next to a hospital where you have air conditioners sucking in the air from those trucks right there across the street from us? Who in the city had the nerve to say it didn't belong here but belonged at Kings County Hospital, where infections, just people walking from the subway to our hospital has to walk sometimes through gunk that's dropping out of those garbage trucks on the soles of their feet, bringing it into the hospital, and now infections and surgery go up. Now, why?
See,
Who's in charge of that? But I fought them. I really had to fight them. I brought down John Noel from CBS, and he did a show on television, and he saw the trucks coming in the garage, and he saw the trucks, and he focused the cameras on the stuff that was dripping out the back of the trucks and things like that, and how people walk right through there on the soles of their feet, walk right into Kings County Hospital. And then all of a sudden, they got right back to it. We got rid of the trucks. It was gone, but somebody says, well, where are we going to put these trucks at? Bring them back to Kings County Hospital.
When the cameras were gone.
That's right. That's right.
So I just want to say that we do have to address things other than what we do as individuals,
Right.
because the environment is very important.
Surely.
And so one of the things that's going on right now to help people at a population level, you know, the bike lanes so people can ride their bicycles and exercise, the green carts that the cities put out there so that you can get fresh fruits and vegetables in areas that you couldn't get them. But we have to be more global in our approach to health than what the individual does, and that's the point of that. So, but having said that, the individual responsibility when it comes to HIV prevention, we have a condom program that gives out over 30 million condoms a year. Over 30 million male condoms. And over 1 million female condoms. In the final analysis, I give them out. So the city of New York pays for them. So that you don't have to say, well, it's either going out to dinner or buying condoms, or I can do this or buy condoms. You don't have to do that.
Right.
But in the final analysis, when it's on your bedside table or in your pocket when you're in wherever you're having sex, only personal responsibility will take over and have you practice safer sex. And so we have what I always call the three-legged stool. There's the things that government can do. Move the garbage trucks. The legislation, the policies, Indoor Smoke-Free Air Act.
Yeah, sure.
These are all government responsibilities.
That's right, sure.
The individual can't do that. They can help by demanding, but the government in the end has to do that. The funding.
That's right, sure.
There's a community to change social norms so that we're teaching sex education broadly in a biologic way in schools. The community can demand that.
That's right, sure.
And then the other leg of the stool is personal responsibility.
Oh, yes. Well, you know, I have to just deviate just one moment from the HIV on personal responsibility. Black women ate Argo laundry starch. Okay? It gave them iron deficiency anemia. Instead of having a hemoglobin of 14, they had 7, carrying babies. I saw that way before I even came into Kings County Hospital, the eating of laundry starch. And when I got into Kings County, I saw women in the obstetrics clinics eating a white material out of a paper bag. They didn't have the box, show the box, but the box was inside the bag. And they would chew on this Argo starch. And they were anemic, carrying babies at hemoglobin 7, which led to having bone marrow aspirations, having iron given to them, injections of iron and things like that. But the source was the Argo laundry starch. So I said, okay, I'm going to go to the throat of the Argo laundry starch. So because Bill McCurry was the first to ever put a doctor on television, and we had the cameras to be shown on Channel 5 where we could reach thousands and millions of people, we did 23 shows on Argo starch. And when we went into the stores, where the Argo starch was, it was not in the laundry area, it was in the confectionery area. Because if it was in the laundry area, the cheap box would absorb some of that bleached taste and it wouldn't be tasty to the people while they were chewing on that starch.
That's a twist I hadn't heard before from you.
Yes, right, yes. And then, so we did 23 shows, and then and the Argo Starch Company got in touch with us and said that, oh, all right, get off our case and so forth, because we have another Argo Starch that's in a red box that we use for gravies. But I'm talking about the blue box that says it allows your iron to work. And that's what starch did. You know, when you had to use the Argo starch, you had to boil it in the pot. My mother was a laundress, and she used to wash clothes of people, iron them, and I used to deliver them after school. So I used to see her use Argo starch. You had to put it in a boiling pot of water, put the shirt in, squeeze it out, put it out on the line. And of course, so I was familiar with Argo starch, but not people eating it the way they were eating a box a day, you know. And so basically, they finally not only put a sign on the box, not recommended for food use, large, but then they had a big splotch on it that says powder only. They only ate it when it's crunchy. Yes, only ate it when it was crunchy. They could crunch it between the teeth. It was something like, we have a jaw reaction here that has a relaxing factor to it. And so when they ate it, they would go down and, of course, pull out the iron into their stools, you know. So finally, we beat them at that game and so forth, and finally they took it off the market. And now Argo starch, which was made in Argo, Illinois, is no longer in existence. So the product is not out there, but people ate it for 85 years as such with carrying babies. You know, so that's what I'm trying to say. If we don't
that's more than personal responsibility. What you did was taking on a corporation.
Yes.
That is amazing that you were able to, with help with the media. That's why media is so important.
Oh yes, I mean you should be having your own media show. When I say that, almost on a weekly basis, never mind just a newspaper, because people don't read newspapers, certainly, and they don't go to the internet for health information so much, our folks as such.
Not as much as they should.
As they should, but...
The other thing, though, with the internet is you never are sure of the source unless you are a researcher and know to go to reliable sources. Because you can read all kinds of garbage on the internet.
Surely.
And YouTube and this place and that place, you can see things. But using the internet, if you're taught how to do it, you can find the reliable sources and get the good information.
Surely.
But I didn't know it was an 85-year history that you were fighting.
Oh, yes. You know, it was and the thing is, it's a whole, people say, well, why would they eat crunchy material like that? I say, well, why do people chew gum? You chew gum and the flavor is gone in about a minute, but you're still moving your jaw. But that jaw is a relaxation, just like an animal has a cow coughs up his curd and keeps chewing. If he didn't, that cow would go crazy also.
You mean it's boring out there in the field?
Boring. But
speaking of boredom, I have to tell you, I have to bring it back to HIV in a way.
Okay.
In a way.
All right.
Because as people get older, often retired, less active, they're not like us, keep on going like the Energizer Bunny.
That's right.
What is the way they often relax? They get together with their friends.
Sure.
Sometimes they play cards. Sometimes they have a few drinks. But often they end up having sex when somebody's available.
Oh, sure. Older people.
Older people.
Oh, yes. Well,
Older
speak
people.
about older people and AIDS.
The thing is that there's a growing number of people who are becoming infected because once women don't have to worry about being pregnant,
Right, sure.
they sort of relax.
Right, sure.
So that's one problem. Once men have difficulty with erections,
Sure.
they go to their doctors and get a prescription.
How about off the black market?
They go to the black market, but they don't have to. They can go to their doctors and get a prescription.
Sure, sure.
But if their doctors won't give it to them because they say it's contraindicated, they can get it from the black market.
Sure.
So that you're talking about people getting erections that in years gone by they wouldn't be sexually active because they couldn't, not just for a couple of hours, but you can get one for 4 days, I hear, whenever you're ready.
That's right.
Or,
Oh, yes.
or you know?
Yes, right. And if you're not careful and have sickle cell anemia, you can get an erection and never be able to come back
That's
to
right.
normal.
And it's not fun.
It's not fun. That's right.
It's called priapism. It's not
Priapism.
fun.
That's right. Explain the priapism.
Priapism is an erection that you get even from sickle cell without having a enhancer, and you can't, and it won't go down because the blood gets into the penis, and you can't get rid of the erection.
Yes,
Can't
which
come
is a
out.
horrible
It's a
situation.
horribly painful condition. It's not fun. No. But now, with the help of your friendly doctor and pharmacist, much older men are having sex outside of their home,
Sure.
getting infected,
Right.
and taking it home. So
Yeah.
maybe at home they only have sex every now and then.
That's right.
And outside they're having sex often.
That's right.
And then they take it home.
Oh, yeah.
And there's one community that I can't remember the name of and wouldn't say if I did, but it's in a retirement area that has a very high prevalence of HIV because of this men having sex outside and going home. And there's a shortage of men relative to women.
Surely, of course.
And so the men have a lot of activity, and HIV is increasing among the older population, and we don't know exactly when they get infected, because we know when people get diagnosed.
Sure.
We don't know exactly when they're infected.
And could I hold you right there, too? Among the religious brothers, that's another thing we have to be concerned about, because churches are not eliminated from this spread of AIDS.
Oh my. They are not. People in the church do the same thing everybody else does.
That's right.
And if any minister is honest, they'll tell you that. Now, they may go weekly on Saturday or Sunday to get an infusion of a reminder. I call it a booster, their religious booster shot on the weekend,
That's right.
to help them and remind them of what they should be doing. But it doesn't mean that they don't do the same thing everybody else does.
That's right.
And so what we need to do is to be honest and talk about it. And we actually have a faith-based ministry from the Department of Health where we have people going out trying to deal with ministers, in addition to other organizations that are doing this. You know, there's something called NBLACA, National Black Leadership Commission on AIDS. They have a whole faith ministry dealing with ministers. And so we need to be sure that we don't separate anybody. I'm going to tell you one joke.
Okay. And then
Reverend Al Sharpton told this. I want to give him credit right here.
All right.
When he was talking to a group of ministers and politicians the other day and saying that the ministers need to get their act together and make sure that they're dealing with HIV, he said, when Jesus was talking, they wanted to stone the prostitute.
Sure. Oh, yes.
And Jesus said, he who be without fault cast the first stone. And then what did Jesus start doing? He started writing on the ground.
Yes.
And when he looked up, everybody was gone.
God, that's right.
So Reverend Sharpton said, I wonder what Jesus was writing on the ground. And then it came to me. He was probably writing the names of those men's girlfriends.
That's right. Oh,
And when he looked up, they were all gone.
Oh, yes, you know.
We don't judge people because all of us have sinned and fallen short.
Right. Well, you know, the thing is that my son and I designed where we could reach the people in church. We designed a fan, because people in storefront churches a lot of times, or in big churches, didn't have fans. And when the sermon gets really hot, you sweat. And so you get moisture under your arms and other places too. But the thing is that, so we designed what is the only word that starts with HIV in the dictionary? I hate to put you on the spot, maybe.
HIV in the dictionary. Isn't that something?
Okay.
HIV-EL, HIV-AL, HIV-OL, Hovel,
No. Hive.
HIV-E,
Right. So we constructed a fan
hive.
in the shape of a bee. And it was this simple. It says, and the HIV was in red with the E. It said, in a beehive, the queen bee abides. If the queen bee dies, the hive will not survive. That's simple.
That's right.
And we wanted to get this maybe through your department now. With the and on the back of the fan it bees that way sometime.
Oh, yes.
And then we put all the things how you can prevent AIDS on that fan. The churches, the ones we tried, took it up immediately. They
So
say,
where is it?
we still have it, but we haven't really promoted it to the level where city or government should take it on. And the black churches, because I write for the black churches, as you know, and so forth, and I do write truths, and I don't go around the thing. But the thing is that that fan, and it was the fan was shaped almost like a bee, but very colorful.
Did you have one when we were on that program together?
Yeah.
Yes,
That's
I
gotta be-
knew that
yeah.
it was. We were on some panel together at a
Right,
church
sure, yes.
a year or so ago.
Yeah, right.
And I knew that I'd seen this.
Yes, right.
Well, I want another one.
Yeah.
And I want to bring it to my prevention committee
Yes,
and our
right.
faith committee.
Yes. Because we could get them out throughout this, it's particularly storefront churches now, you know, where they get less information in a sense, you know. In fact, I was at a conference.
And there's no advertising of
No advertising.
anything on it.
No advertising at all. Only that the queen bee dies. And since the queen bee is the one that's most infected over the males in a sense, when you think about just because of the surface where a virus can get in much faster in the vaginal area. And
Transmit
things like,
it more.
Transmit it, yes, you know. But we have to be that simplicity. I have found simplicity in health works much more than all the complications. When you talk about words like disparity, diversity, people don't know what disparity means. All they know they're depressed because of disparity. You know?
They don't know, and we do have to keep it simple.
Very simple.
Keep it simple is a way to go. And the simple message is an ounce of prevention
That's right.
is worth a pound of cure.
There you go.
And it sounds trite, but when everybody knows that they have a role in prevention,
Surely.
you know, the two of us here,
Surely.
if something sexual was going to go on, it would only take one of us to say, hold it.
That's
Wait
right.
a minute. Where's your condom? So what I do is, and I left my pocketbook on the other side of the room, I often take out my umbrella and a condom. They're always in my bag.
Right.
I said, I carry both every day. I may not need either one of them, but I have both just in case.
That's right.
We have to have people understand and be prepared.
Yeah, sure.
Because the least time you think it may happen, especially in our community,
In our communities, yes.
it could happen.
Oh, yes, because I have seen heads of religious organizations die from AIDS.
Oh, absolutely.
know.
They're not spared. The HIV, the virus does not check your resume before you get infected.
That's right.
If you engage in the activity,
Surely.
you have the risk of becoming infected. And that goes across the board.
And you know, and when you now think about teenagers, you know, how they're having this kind of problems now with the Facebook and things like this. They're talking about 11 and 12-year-old girls having sex with older men.
For the bling, for
Yeah.
the sneakers, for the jeans,
Yeah.
for the phones.
Oh, yes, yes.
So
you know.
we have to start with our adolescents, and I'm so happy that the Department of Education has now made it compulsory to have sex education in the schools K through 12.
Right, sure.
Because one of the problems that happens is if you put it off too late, you miss the opportunity. Between around 13 to 15% of students have had sex by the time they graduate from middle school.
That's right. You know.
So if we're trying to wait until high school to give them these safety lessons, then we've missed the boat.
Well, Dr. S.U.N.Y, I tell you, like, since time is our enemy, and it looked like we spent an hour, like, all together, we're going to do this more often because it is of such importance. Such importance.
It's my
You don't
pleasure.
have to have your own show. You can have your show here at Downstate Medical Center, where we have health center being done every week. So if you wanted to come every 2 weeks, every month, and talk about this so we can get ahead of these kind of things, it would be my pleasure, and certainly
And
to our
mine.
staff, and to our staff here, which does an excellent job. I mean, you wouldn't think that 2 men run an organization like this. 2 men do all of this televised and doing all this wonderful work here at Downstate Medical Center. We have a state-of-the-art studio right here, run by two dudes, and they know their
Wonderful.
stuff. That's right. So, again, it's a pleasure having you with us
Thank
today.
you so much,
know.
Dr. Deas. You are, just being with you is such a pleasure.
Thank you
It's
so
great
much.
to see you.
So you folks, get hold of yourself, do the right thing,